So, good day, everyone. So, for week 7, we are going to talk about donor screening and blood donation. Okay, so let's start. First, sa donor screening, so first step natin is the registration ng patient or the donor. Okay, so anong kinukuha natin sa registration? We ask for their name, so date and time of the donation, their address, contact numbers, and then their other identifiers. Then ang pinaka-importante is yung consent to donate. So yung kasulatang nagsasabing pumapayag sila na mag-donate ng blood. So yeah, need yan ipasign kay patient. So once registered na si patient, okay na siya, proceed sa physical examination. Okay? So the age at least 18 years old dapat or 16 to 17 years old if the law permits. Okay? So body weight minimum is 50 kilograms or 110 pounds dapat. Sa ibang institution, hindi rin sila napayag na saktong 50 talaga. Dapat 51, 52. Kasi, ang reason is, may damit pa daw si patient kapag natanggal yung damit, baka less than 50 pa pala siya. Okay, so yun, 51 or 52. Ganon. So, temperature, not to exceed 37.5 degrees Celsius or 99.5 degree Fahrenheit. So, dapat walang lagnat si patient. Okay, normal body temp dapat. Sa pulse niya, it is dapat 50 to 100 beats per minute. Lower pulse, acceptable kapag athlete si patient. Blood pressure is not higher than 180 over 100. In some institutions, 120 over 80 lang talaga ang tinatanggap. Okay? Higher than that, nire-reject na si patient or si donor. Okay? So, hemoglobin hematocrit niya, kapag allogenic donation, dapat 12.5 grams per DL ang hemoglobin and then 38% si hematocrit. Kapag autologous naman, 11 gram per DL dapat si hemoglobin, 33% naman si hematocrit. Ito yung minimum requirement. Okay? So next, after that, we have our medical history questionnaire. So this one is essential to ensure protection of the donor and benefit to the recipient. So, medical history dito, papasok yung questions about their history, kapag may history ba ng high blood sa family, diabetes, and so on. May history ba ng bloodborne diseases, like yung mga ganong bagay. Okay? So, designed to be self-administered by the donor, but if preferred, may be administered by a trained donor historian. So, yan. So, meron tayong times, may mga pagkakataong hindi natin tinatanggap si patient because of some reason. Okay? So, ang tawag natin doon is deferral. So, we have different types of donor deferral. Okay. First one, we have temporary deferral. So, prospective donor is unable to donate for a limited period of time lang. So, temporary lang na hindi siya pwede mag-donate. For example, si donor naka-receive ng blood transfusion, defer siya for 12 months from the date of transfusion. After ng 12 months, pwede na ulit siya mag-donate. Okay. Tapos, like this one, donor has received vaccination for yellow fever. So, defer for 2 weeks lang. After that, okay na ulit. Or kaya naman, may lagnat pala, pumunta siya sa donation site, may lagnat pala siya. So, deferred siya until gumaling siya. Okay, so yun yung temporary deferral. Next, we have indefinite. Okay? So, prospective donor is unable to donate blood for someone else for an unspecified period of time due to current regulatory requirements. So, this donor would be able to donate blood until the current requirement changes. So, pag indefinite, unspecified period of time, siya hindi pwedeng mag-donate dahil sa regulatory requirements na meron. Okay? Pag nawala yun, or pinayagan na ulit sila, so pwede na siya mag-donate. For example, donor states they have lived in England for 1 year in 1989, deferred indefinitely. Okay? Basta they have lived in England for 1 year, different indefinitely. Once na nawala or parang nilift na itong requirement na to or regulation na to, so pwede na sila ulit mag-donate. So yun yung indefinite deferral. Last, we have the permanent deferral. Okay? So, permanent, so never na talaga silang makakapag-donate. Okay? So, will never be eligible to donate blood for someone else. So, these donors may be eligible to donate autologous blood. Okay? So, autologous blood, meaning yung i-donate niya, siya din ang gagamit. Okay? Yun yung autologous. So, hindi na sila pwedeng mag-donate ng blood for someone else, pero pwede pa sa kanila mismo. Okay? So some permanent deferrals may result from testing performed on the previous donation. For example, si donor nag-positive sa Hepa C nung hepatitis C. Okay? So permanently deferred na siya. Okay? And also other bloodborne diseases. We have hepatitis C, kaya Hepa B, HIV. Yan, mga permanent deferred na yung mga donors na yan. Okay? So, ito din. Pag nagtitake ng certain medication si patient, meron din tayong dine-defer. Okay? For example, this types of medication. So, Fildine. Okay? So, this is medication for mild to moderate arthritis. So, 2 days deferred siya if platelet apheresis ang kukunin. Kapag whole blood naman is no deferral. Aspirin and piroxicam, 3 days for platelet apheresis and no deferral for whole blood. We have Plavix and Piclid, reduce change of heart attack and stroke. Yun yung gamit ng gamot na yun. 14 days sa platelets. No deferral naman for whole blood. This one. Proscar, which is for prostate gland enlargement, Propecia and Accutane. 1 month deferral. Avodart, 6 months deferral. Hepa B immune globulin. This one is Hepa B vaccine. 1 year deferral. Soriatane, 3 years. Ito naman yung mga permanent natin. Kapag si patient nag-take ng Tegison, ng growth hormone, permanently deferred na sila. Okay? Pag nag-take naman ng insulin from cows, indefinite. Okay? So, dito papasok yung importance ng medical history questionnaire. Okay? Lahat ng to, tinatanong doon. If ever may tinake sila ng gamot, tinitake na gamot, meron bang tinake na gamot before, okay? May history, nagpa-vaccine ba recently, nandun yun sa medical history questionnaire. Okay? So let's proceed with the blood donation. Okay? First, let's talk about autologous donation. So, autologous, again, at sinabi ko kanina, this one, donor donates blood for his or her own use. Okay, siya lang din ang gagamit. So, donor referred to as donor patient. Okay? So, anong purpose nito? Okay, number 1, to treat surgical blood loss. Okay, so decrease risk of disease transmission kasi blood mo lang din naman yun. Okay, so sigurado ka na hindi ka makakahawa ng sakit. Okay, so decrease transfusion reaction and alloimmunization. So greatest advantage for those very rare blood types. Okay, and those with multiple antibodies. Okay, so yung mga mahirap hanapan ng ka-match na blood, so autologous donation ang pwede sa kanila. Kaya lang, higher cost siya because of added administrative process and then special labeling sa kanya and high percentage of wasted units. Okay? So, ang criteria, no age limit naman for autologous donation. Hindi rin sila strict sa weight requirements. However, ang hemoglobin and hematocrit, it should not be less than 11 grams per DL for the hemoglobin and 33% sa hematocrit. So we have different types of autologous donation. Number 1, we have pre-operative collection or pre-deposit donation. Okay, this this one occurs during 5 to 6 weeks immediately preceding a scheduled elective surgical procedure. Okay? So last blood collection should occur no less than 72 hours or 3 days before the scheduled surgery to allow volume replacement. Okay, so most autologous units are standard for 50 or 500 ml with plus minus 10%. Okay, so pag pre-operative, okay, kunyari nakaschedule si patient for a surgery, so around 5 to 6 before that surgery, nagpe-prepare na, nagdo-donate na si patient ng blood, tapos tinatabi yon na gagamitin naman if ever needed during the surgery. Yun yung pre-operative collection. We have immediate preoperative hemodilution. This one is performed immediately prior to beginning the surgical procedure and is managed by anesthesiologists. So results in the collection of whole blood with the concurrent infusion of crystalloid or colloid solutions. So blood is normally reinfused to the patient during or immediately following surgery, but within 8 hours of collection, thus maintaining the viability of both platelets and coagulation factors. So immediate preoperative, right before the start of the surgical procedure, kukuhanan ng dugo si patient. So it's managed by anesthesiologists. So meaning, nakahiga na talaga si patient sa surgical bed, tsaka lang kukunin tong blood sample na to. Yun yung kinaibahan niya sa preoperative. Okay? So, collected blood is hinahaluan natin ng crystalloid or colloid solutions. Kaya siya hemodilution, na dilute din si blood. Kailangan matransfuse na siya immediately or right after, but within 8 hours. Kasi after 8 hours, mapapanis na si blood, hindi na siya viable for transfusion. So we have intraoperative collection. So this one involves collecting shed blood from surgical site and then processing the blood through an instrument that washes it with saline and concentrating the residual red cells and then reinfusing those cells immediately. So this one is used in cardiothoracic, major orthopedic, and cardiac surgeries, in addition to vascular surgeries such as liver transplantations. So intraoperative habang ongoing ang surgery. Yung mga blood na nako-collect, itinatransfuse din agad. Okay, yun yung intraoperative. And lastly, we have post-operative. So collected from a drainage tube placed at the surgical site and then reinfused with or without processing via a microaggregate filter to screen out debris. So this one is characterized as being diluted, partially hemolyzed, and defibrinated. And then blood must be reinfused within 6 hours of collection or it is discarded. So post-operative, yung mga na-collect na blood from the drainage tube, yun yung itinatransfuse kay patient after the surgery. Kaya post-operative. Okay. So next we have apheresis donation. Okay. So apheresis, it is a type, gumagamit tayo dito ng machine, okay, para i-separate kung ano lang yung gusto nating kunin. For example, this one, platelet pheresis. Okay? So, pag nag-donate ng blood si patient, okay, yung blood is dumadaan sa machine para paghiwalayin niya yung red blood cell sa platelet. Okay? So, ang makukuha lang natin sa blood bag is purong platelet lang. Okay? Yun yung apheresis. Okay? So, yan. Number 1, we have the platelet pheresis. So platelets obtained by an apheresis procedure provide the equivalent of 6 to 8 whole blood-derived platelets. Okay, so isang session ng platelet pheresis, 6 to 8 whole blood-derived platelets na agad ang equivalent. Okay. So a sample must be collected to determine the donor's platelet count. It must not be less than or at least dapat 150,000 per UL. Ang platelet count ni donor. So each apheresis platelet unit is required to contain at least 3 times 10 raised to the 11th power of platelets. Okay? So collection should not be performed on potential donors taking medications that interfere with platelet function. Next, we have plasmapheresis. So this one, plasma lang ang kinukuha natin. So each unit is the volume of equivalent of at least 2 whole blood derived plasma units. So this is used to augment the inventory of fresh frozen plasma of a particular ABO group. So some are collected to further manufacture immune globulins. We have leukapheresis. Okay, ang kinukuha natin is granulocytes or leukocytes, white blood cells. Okay, so typical therapeutic dose is at least 1 times 10 is to 11 granulocytes each day for 5 consecutive days. So this one therapeutic dose for those neutropenic patients. Okay? Wala talaga or sobrang baba ng leukocyte count. Okay? So, yun ginagawa natin. So, granulocyte transfusions have been shown to be beneficial in some severely neutropenic patients. So, it also has shown favorable results in the treatment of neutropenic neonates with sepsis. So, collection of granulocytes by apheresis provides a higher yield product that those prepared from whole blood collection. So in order to collect a large enough volume of leukocytes, so we use certain medications or reagents, something. So we have hydroxyethyl starch. So this one enhances the separation of the white cells from the red cells during centrifugation. We have corticosteroids naman. So they work by pulling the granulocytes from the marginal pool into the general circulation. So and last we have granulocyte colony stimulating factor. This one is a recombinant hematopoietic growth factor. So administered to donors administration to donors has resulted in marked increase in granulocyte yield. Okay? So how frequent can a donor donate? Ayun. Okay? So we have RBC. Okay. So RBC. This one is, wait, let me check. Okay. 2 RBC ang nakalagay kasi referring to apheresis na RBC. Okay, kaya 2 bags na RBC. But pag whole blood, same lang din, 16 weeks. 16 weeks. Okay? Plasma. Okay, next. Okay, again, pag RBC, 2 RBC or whole blood, 16 weeks din. Okay? Every 16 weeks, pwede mag-donate si patient. Okay, pag plasma frequent, meaning sanay na si patient, palagi na siya nagdo-donate ng plasma. Every 2 days pwede, but no more than 2 times in 7 days. Pag infrequent naman, or hindi naman siya madalas mag-donate, every 4 weeks siya, but no more than 13 times in a year. Okay? We have platelets na single unit lang. Single unit ang i-collect. Pwede ka mag-donate every 2 days, but no more than 2 times in 7 days, and no more than 24 times in 1 year. Okay? Platelets naman, double or triple units, you can do every 7 days. And then granulocytes, you can do every 2 days. So whole blood, let's proceed with whole blood collection. Okay, whole blood collection. So during whole blood or any collection naman, we use aseptic technique. Okay? So most blood centers use an iodine compound such as PBP iodine or polymer iodine complex. Okay? So using a tourniquet or blood pressure cuff, the manufacture site is identified and the area is scrubbed at least 4 centimeters in all directions from the site for a minimum of 30 seconds. So the area is then covered with a dry sterile gauze pad until the venipuncture is performed. Okay? So usually 3 times tayo nagki-clean for blood donations. Okay? We use iodine first and then followed by pag natuyo na yon, alcohol and then iodine ulit. Okay? So yun. Pero depende pa rin sa protocol ng institution. Okay? So we have chlorhexidine gluconate isopropyl alcohol may be used to donors who are allergic or sensitive to iodine compounds. Okay. So, ano ang expected donor reactions natin if there are any? So, we have mild, moderate, and severe. So, mild reactions na we have yung syncope or fainting, dyan yung nausea or vomiting, hyperventilation, twitching, and muscle spasms. Yan yung nanghihina, may hilo si patient. Ayan, mild reaction pa lang yan. Moderate reaction, yung mild reactions in addition to in addition to loss of consciousness, pag nahimatay na ng bongga si patient at hindi agad nagigising, ayan yung loss of, andyan na yung moderate reaction. Severe naman kapag nag-convulsion si patient, okay, marked hyperventilation or epilepsy, ayan, severe reaction na siya. Okay. Possible din, most common na maging result is hematoma, magkapasa si patient. That's why we ask them to keep pressure for at least 5 minutes. Hindi natin agad pinapatayo si patient sa chair. Kasi pag tumayo baka biglang mahilo, biglang matumba. So pahinga muna sila habang nakaaga-apply ng pressure for at least 5 to 10 minutes bago natin sila pinapaalis sa donation site. So, ano bang ginagawa natin sa blood once we have it na? So, paano natin siya pinaprocess? So, first, syempre, tinetest natin kung ano bang blood type niya. ABORH. And then, it also undergoes antibody screening. Okay? And then, we test it for blood-borne diseases. Okay, so we have Hep B, HB-Sag, anti-HBC, HCV, anti-HIV, anti-HTLV, WNV-RNA for syphilis, T-Cruzi, and platelet bacterial detection. This one is done for platelet component. So yan yung some, if not all, tests na ginagawa natin sa blood. Okay? So yun. So once na-screen na si patient, meaning na-test na siya for different diseases and negative naman ang resulta, that's when we keep it na sa blood bank ref. Okay? So okay na siya for transfusion. Yan. Okay. So that's it for our lesson this week. Okay, so if you have any questions, you can message me po or your respective instructors. Okay, so thank you.